So, as I mentioned earlier, the connection between semester one, where they're learning simple concepts from range of motion, MMT, gait, palpation, to semester four, where they have to integrate what they learn into a more complex format. So, being able to integrate, let's say, the peripheral joints, such as the hip, adding the spine content into it. So, an example would be here. So, Mike, please. So here, they, as you can see, they learned the hip extension range of motion. And then next, please. And then also semester one, they learned that if somebody lacks hip extension range of motion, perhaps the joint mobility is restricted. And if they assess the joint mobility and found it to be limited or hypomobile, then they can provide hip extension joint mobilization. And then moving on to gait. So first semester, they may learn, okay, so for gait, normal gait pattern involves during late terminal stance to pre-swing, the hip extension has to be about 15 to 20 degrees right there. And then we move on to the next slide. And then in semester four, then they start learning that perhaps in patients that have spinal stenosis, during the same terminal stance, late terminal stance and pre-swing, the hip range of motion is actually lacking hip extension. They may not even go to neutral. And so patients may excessively use their lumbar spine into extension, and so may have pain because of that. So then next, please, Mike. So here's an example snapshot of a template, the lab handout that we give out to our students. So the CPG, the clinical practice guideline for low back pain with radiating pain, folks that have lumbar spinal stenosis and they favor their directional preference is flexion. They're sensitive to extension. So improving hip extension for these patients might be helpful to reduce some of their problems. So here's an example of how I scaffold what they learned from semester one and move them into semester four for advanced orthopedics and sort of invite them to use what they learned and then transfer that learning into the spine. Mike? And so in the app, you'll see that for lumbar spinal stenosis, the clinical finding is a short video, 1 to 2 minute video that shows the students what are some things that they need to look out for. For example, folks that have range of motion deficits for hip extension, they may excessively use their lumbar extension and may have pain and irritate the nerve tissue. Next. And so here, under clinical reasoning, the key findings, this is another section of the app under spinal stenosis or low back pain with radiating pain. It shows some of the ADLs that patients may find themselves to have pain because these are extension or excessive extension activities that patients may have pain in. Next, please. And so again, in the clinical reasoning key findings portion of the lumbar spinal stenosis, they would learn that perhaps hypomobility in the surrounding tissue, in the surrounding regions above and below the low back, lumbar spine, such as the thorax, pelvis, and hip, may contribute to the problem that the patient's having. And then we move on to the next slide. And also under clinical reasoning, some of the interventions that therapists may use in the clinic may involve correction of posture, but also correction of movement. So the hip extension that's lacking is one way that we can correct our patients to help them have less symptoms. And beyond that, then reduction of neural entrapment sites, such as what's happening in the low back with nerve irritation.
Yeah, the same thing for us in our cardiopulm class. So in the cardiopulm class, my chair said, hey, we have challenges helping the students see context to figure out what are these types of patients that they've never seen before. And so we found...
Mike, I have a question from Stella.
Sure.
Sorry about that. He's asking, are we able to access this through our current accounts, or are these add-ons?
No, everything that you see here is available to you and will be available to all faculty members for you to utilize in your class. We give all of these resources to the faculty to use because we really believe it can enhance the classroom. So if you don't have access yet, please know that we will be sending out an email in the next couple of days with login access for all faculty. And for those of you who already, if you don't hear from us, please feel free to email me. We will get access for you.